Welcome to Vision for California, a web series of discussions on California's healthcare reform, hosted by Senator Dr. Ed Hernandez, Chair of the Senate Health Committee. Today's guest is Sarani Kwan, the President of the California Association for Nurse Practitioners.
Thank you for joining me. Today we're going to be talking about the role that nurse practitioners play on providing healthcare here in the state of California. Thanks for being with me today. It's great to have you here in the state capitol, and let me first of all start by congratulating you on being elected as President of the Nurse Practitioners Association.
Thank you very much, Senator Hernandez. Thanks for having me.
So tell me, now that you're President of the Association, what are your goals this year as President?
The goals this year are to continue to expand the scope of nurse practitioner care in the state of California. We're always looking for ways to expand access to patients throughout the state.
Great. Now tell me a little bit about, what it takes to become a nurse practitioner, the educational requirements, and how long.
Well, how long can depend on many factors, but essentially all nurse practitioners start out as nurses, registered nurses, and you apply for a master's level program, and it's typically 2 years, sometimes 3, depending on the length of time you choose. And there is then practice time. When you're actually in school, you work in clinic and learn how to diagnose and treat different diseases, which you don't do as an RN.
Right. Now, more and more of them, my understanding is they're moving now towards doctorate levels.
Correct.
Is that correct?
Correct.
How many would you say, or how many schools and colleges here in California across the country are now offering doctorate levels above the master's degree level?
Well, that actually is changing every day, so I couldn't tell you an exact number. We have at least 5 programs in the state of California offering a DNP.
Okay.
It's a Doctorate of Nursing Practice.
Okay. Well, what I'd like to spend some time with you today talking about is workforce and workforce issues. Over this last year, we've been doing some select committee hearings on that exact issue. As you know, federal healthcare reform is going to occur in 2014, and I've always said that let's say 2014 occurs and everyone wakes up the next day with a health insurance card, and it's got low deductible, low at cost. That is still not going to solve the problem.
Exactly.
And the reason why it's not going to solve the problem is we're going to have a huge shortage of primary care providers.
Correct.
Okay. And what we've been finding out through our workforce hearings is that the primary care physicians that we have now in the state of California are barely meeting the demand. And of those physicians, 25% of them are over the age of 65. So we're going to even have a shorter shortage because we're going to have the baby boomers coming up.
Correct.
So what I'm saying is we need to utilize the current workforce that we have now. And I believe the providers or the professionals that are suited for that are the nurse practitioners. And exactly what you said when your opening comments is about expanding scope of practice for your profession. Let's talk about that, and let's talk about the role that nurse practitioners are going to play in providing health care for the state of California. How do you see yourself, and how do you see nurse practitioners playing that role?
Well, as you had said, with healthcare reform, regardless of how it comes out for the entire nation, we still have about 5 million additional patients that need care in the state of California. And unfortunately, there are not enough primary care providers, physicians, to care for 5 million more patients. Nurse practitioners are perfectly poised to step into the void. For basic health care, we can do diagnosis and treatment. I think the best model really is to use the physicians for the tertiary level care, for the sicker patients, the patients that need the highest level of medical care because they're so ill. Nurse practitioners can absolutely do physicals. We can do all your annual care, your school physicals, DMV physicals, all of those types of things, and get those patients taken care of and seen much faster than would a primary care physician.
So what are some of the obstacles that are keeping nurse practitioners from doing that right now in the state of California?
Well, some of the obstacles are that nurse practitioners work under standardized procedures, so we are not independent in the state of California. Several states in the nation, 23 to be exact, have independent practice for nurse practitioners, which means you can hang out your own shingle and open up your own office and clinic. But in the state of California, we work collaboratively with physicians, which we would continue to do regardless of whether we're independent or not. But the physician can really oversee only 4 nurse practitioners at a time. And then the second barrier is that under standardized procedures, you really are limited by what you can do based on what you have agreed upon between your physician and yourself in your office in a standardized procedure.
So these are some of the barriers. So tell me, you talked a little bit about the rest of the country, and the argument's going to be, well, nurse practitioners aren't qualified, they shouldn't be seeing patients directly, they need to be overseen. So why is it that other states can do it, and what's the argument that you can now do it in California?
Well, I think nurse practitioners are absolutely qualified to see patients independently. And in fact, I would argue that in some office situations and even clinics, we do function independently very much of the time. There are often days that I'm working by myself in my own community clinic without a physician in sight, and they aren't ever going to be there during that particular day. So it's not that nurse practitioners are not capable of actually being independent, it's just that we have these legislative barriers that prevent us from functioning independently.
Right. Well, let's talk a little bit about at a national level, and of course here in California they're going to say that there's patient safety at risk. I see it at a national level, and the reason where I would make a decision is that an entity or a profession should have national standards, which you do. They should have national testing, which you should do. And it's been proven in other states that it's safe. But more important is that there should be an independent board overseeing to protect the consumer, and that is here in the state of California.
Right.
Have there been how would you then argue that because we don't do it in California, and we've done it in other states, how do we continue to argue that we should now do it in California? What are some of the reasons why we should, besides just the access issues?
Well, I would argue that we actually do have a board that oversees us, and that's the Board of Registered Nursing.
Okay.
And that has always been our oversight, and they are more than capable of protecting the consumer from any mishaps that might occur, which they have been doing for RNs for many, many years.
Right.
So nationally, the same process exists. The other states that have independent practice have their Board of Registered Nursings oversee the nurse practitioners, and I would argue that care is actually quite safe, and you don't see as many issues with nurse practitioners in independent states as you would expect if you thought that nurse practitioners couldn't care for patients independently.
Right. Well, let me tell you about some of the concerns that I have with regard to the access issue and the workforce issue. And what we've been seeing over our committee hearings is that, yes, it's true, we have we're going to have a very high physician shortage. But we also have a distribution problem, whereas most of the physicians have a tendency to go to the more affluent communities. And we have a very big distribution problem in the rural and the inner city. But what's interesting is where we don't have a distribution problem is amongst osteopaths and foreign-born physicians, but we don't seem to have, obviously, a distribution problem in nurse practitioners.
Correct.
So and then there's always still the argument that, well, if we're now going to have a different type of healthcare system for the rural or the poor areas, is that justifiable? And I say yes, because right now there's essentially no healthcare system there.
Correct.
So tell me, how do you think nurse practitioners are going to play that role in the inner city and the rural to address those issues?
Well, I would argue that nurse practitioners are already filling those gaps. I mean, I myself work in a very rural community outside of larger city. And nurse practitioners actually are well suited to work in all types of settings, whether it's rural or inner city. There are several nurse practitioner run clinics that are actually functioning right now in the LA area and San Francisco, doing quite well to offer care to underserved patients. But there are just as many nurse practitioners working in private offices in medium to large cities as well. So I really feel that it's really a question of volume. There's enough nurse practitioners to see the patients that we have in the state of California that require care, whether you're underserved or middle class.
Right. Okay. Well, let's talk a little bit about, we know there's a good distribution of nurse practitioners. You're qualified to be able to provide that care. There's a national standard. We have a state board that oversees to protect the consumer. Let's say nurse practitioners do have the ability to see patients directly. We can utilize them to the highest level of their scope of practice. Now, what about the actual reimbursement? Is there going to be issues with insurance companies being able to reimburse you as an independent practitioner? Do you see any obstacles there? And maybe you may want to talk about that a little bit.
Well, actually, there are some obstacles. Medi-Cal, fortunately, does reimburse nurse practitioners at 100% of the visit cost, as they do physicians. Mm-hmm. But Medicare is the biggest problem. And typically, many of the insurers follow Medicare guidelines. And so Medicare, unfortunately, reimburses nurse practitioner care at 85%. So you have a patient come in for a physical, and the bill is really the same whether it's a physician or a nurse practitioner, but the nurse practitioner billing independently would only get 85% of what that physician would bill for the exact same visit and the exact same care.
Right.
It's very unfortunate, and that is a national problem that is being worked on. But until that is addressed, there will be some issues regarding the ability to, I guess, pay your bills, if you want to be very frank about it. If I'm making 85 cents off a dollar, it's a little harder to pay the electric bill than somebody who's getting $1 for $1's worth of work. Right. And I think that the insurers certainly don't also impanel nurse practitioners, which means they don't recognize nurse practitioners as providers. So I am offering the same level of care, doing the exact same types of exams, but the insurance companies don't recognize me as a provider.
Right. Now, what would it take for the insurance companies to do that? Is that something statutorily, or do you think that's just more of a cultural change that needs to occur here in the state of California?
It could probably be a little bit of both.
Okay. All right. Well, let me thank you for being here. I appreciate the time, but more importantly, I want to congratulate you on being president of the State Association. I look forward to continuing to work with you, and thank you for joining us today.
Thank you.
Sure.
Today's production of Vision for California with Senator Ed Hernandez featured special guest Sarani Kwan, the president of the California Association for Nurse Practitioners. We invite you to check back for upcoming segments. Thank you for watching. See you next time.